13 warning signs that say your kidney is in danger. It is believed that 15% of adult Americans suffer from renal disease, and the majority are unaware of it. 9 out of 10 persons with kidney disease are actually unaware that they have the illness, according to studies. This statistic is concerning. As with any illness, it is imperative to have a diagnosis and treatment as soon as feasible. Our mission is to raise awareness of kidney illness and the sometimes ignored, subtle symptoms of the condition. Watch to find out more about the condition, its risk factors, and the 13 early warning symptoms of kidney disease you should be aware of. On each side of your spine, beneath the rib cage, lie the kidneys, 2 bean-shaped organs. Through urine, they are in charge of removing extra waste, fluids, and other contaminants from your blood. To put things in perspective, kidneys in good condition can filter about half a cup of blood each minute. However, renal disease impairs kidney function. As a result, your body may amass hazardous amounts of fluid and waste. Apart from eliminating pollutants, the kidneys perform numerous other duties. They generate a kind of vitamin D that is essential for healthy bones, balance the water and mineral content of your blood, and manufacture a chemical that causes your body to produce red blood cells. Kidney illness is likewise detrimental to all of these functions. We shall talk about it later. Warning signs of kidney disease. You might not exhibit any symptoms or indicators at all in the early stages of renal disease. As your kidney impairment worsens over time, you may experience new symptoms. Watch out for these probable indicators of renal illness so you can receive treatment as soon as possible and avoid the condition from going undiagnosed. 1. Frequent urination. The most typical sign of kidney issues is the occasional, more often, urge to urinate. Actually, this is the primary indicator that anything is wrong with the urinary tract. Urination patterns can be altered by kidney illnesses, including the need to urinate frequently at night, a noticeable change in urine color, dark yellow or red, and a persistent urge to urinate. Other symptoms that may possibly exist include discomfort or soreness when urinating, turbid and frothy urine, blood stains in the pee. 2. Fatigue or extreme tiredness. Erythropoietin, EPO, a hormone that tells your body to make red blood cells, is produced by healthy kidneys. Your body makes fewer red blood cells as your kidneys start to fail because they are producing less EPO. Anemia is a condition where the brain does not get enough oxygen, and it can be caused by a low red blood cell count. This can make you feel weak, exhausted, or lightheaded. It's possible that you're experiencing memory and concentration issues, or that you feel mentally tired more than usual. 3. Swollen face or feet. It's common knowledge that drinking a glass of water in the morning will help minimize edema in your face. No matter how much water you consume, facial edema is inevitable when you have renal illness. Your face may become puffy or swollen due to a buildup of toxins that your kidneys are unable to remove. An additional complication of kidney illness is sodium retention, which can also result in swelling in the feet or ankles. 4. Metallic taste in food. Taste changes are extremely common in patients with renal disease. Food can taste metallic and leave a harsh aftertaste when waste builds up in the blood. Regretfully, this may make it challenging to eat even your favorite dishes. The accumulation of garbage not only alters the flavor of your food, but can also give you poor breath. 5. Foamy and blood in urine. Froth in your pee is a sign there are high levels of protein in it, especially if you have to flush a few times to clear the bubbles. Hint, it may look like the foam you see on the surface when you're scrambling eggs because the type of protein that ends up in urine is the same as the albumin found in eggs. If you ever notice any red stains in your urine or blood clots coming out with your urine, make sure to consult a doctor immediately. A sudden change in the color of your urine, red and dark, is a sign or presence of blood in your pee, which is a critical sign of a kidney problem. The condition is referred to as hematuria. 6. Shortness of breath and puffiness around your eyes. Breathlessness can also be caused by CKD-induced anemia, which is a lack of oxygen-carrying red blood cells, persistent puffiness around the eyes. An early indicator of kidney disease can be caused by protein leaking into your urine as a result of kidney damage and dyspnea due to excess fluid accumulation in the lungs. 7. Muscle cramps and sleep problems. While the occasional cramp is natural, more frequent cramping can be brought on by renal failure. A few factors can cause CKD to interfere with your sleep. Your blood can become clogged with toxins, which can cause you to stay awake. Obstructive sleep apnea, OSA, which can induce frequent brief awakenings during the night, and chronic kidney disease, CKD, are both underlying conditions caused by obesity. Moreover, having to use the restroom late at night might cause significant sleep disturbances. 8. Localized pain. On either side of your spine, your kidneys are situated in the back of your belly. A problem with your kidneys may be indicated if you have localized pain in your middle to upper back or on your sides. Muscle cramps are another mild symptom to watch out for, in addition to back or side pain. Different electrolyte imbalances, such as low calcium or excessive phosphorus levels, can be brought on by kidney illness. Your arms and legs may therefore hurt physically or feel as though you have pins and needles. 9. Unexplained loss of appetite. Appetite loss is one of the most prevalent symptoms of chronic renal disease. It is significant to remember that one of the main indicators that your kidneys might be in danger is a chronic loss of appetite. 10. Dry and itchy skin. Your kidneys are in charge of maintaining the proper concentration of minerals in your body and healthy bones. Dry skin and itchy patches can happen when your kidneys are unable to keep the minerals and nutrients in your blood in a healthy balance. Kidney failure-related rashes typically feel deeper than a typical rash and are not responsive to topical treatment. 11. Nausea and vomiting. Severe waste and fluid accumulation is common when the body is unable to eliminate toxins. Long bouts of nausea and vomiting may occur as a result of your body's urge to eliminate these toxins. You may lose weight and lose your appetite as a result of this nausea and vomiting. 12. Stones-like formation in urine. Urine color changes are unquestionably a sign of a chronic kidney illness, but your kidneys may also be at danger if you or your family have a history of obesity or renal stone disease. 13. High blood pressure. Hypertension can be a presenting symptom of kidney disease. To rule out renal etiology of hypertension, a thorough workup of renal functions and kidney imaging is required for everyone receiving a diagnosis of hypertension. High blood pressure is caused by sodium and water retention that occurs as renal function declines. Headache, nausea, blurred vision, and maybe the initial signs of renal disease are all symptoms of hypertension. Risk factors of kidney disease. The chance of getting kidney disease might be elevated by several lifestyle variables and diseases. Diabetes, hypertension, heart disease, smoking, obesity, and a history of kidney disease in the family are a few of them. Make an appointment with your doctor if you have any of these illnesses so that you may talk about your risk factors and have a kidney disease screening are adversely impacted by kidney disease as well, which we shall talk about later. When to see a doctor. Early detection makes renal disease much easier to treat successfully. In order to halt the advancement of kidney damage, your urologist will first identify the underlying reason. Renal failure may result from advanced renal disease, in which case survival may depend on dialysis or a kidney transplant. While any of the above-mentioned symptoms could be indicators of renal disease, testing and seeing a physician are the only ways to be certain. The earlier you identify symptoms and consult a specialist, the faster your kidney disease diagnosis and treatment can begin to halt its advancement. Thank you for watching. Subscribe to our channel and hit the bell icon for more informative videos.